Yesterday on July 4th, 2015, Neymar Jr. was stretchered off after a fractured vertebrae injury after Juan Juniga's controversial tackle 3 minutes from time. Brazil's beloved player, who is their leading scorer in the competition and a crucial element of their quest for the World Cup, with 4 goals and an assist, is leaving Brazil fans worried about their chances of winning the entire competition. Here's a clip of what happened.
It is Neymar after that challenge.
So let's go through what actually happened as Zuniga's tackle hit Neymar on the back. We see Zuniga coming from about 5 or 6 yards away, and upon jumping, throws significant force with his patella, or kneecap, straight into a sensitive area of Neymar's back.
Weighing in at 159 pounds, or 707.27 newtons, Juan Camilo Zuniga has a mass of 72.2 kilograms. Although not all of this mass was directed at Neymar's vertebrae, all parts of the body more or less contributed to the force that derived from Zuniga's kneecap, also known as a patella.
His high sprint speed and acceleration are very important to consider when assessing the magnitude of this injury. And trust us, when Neymar pulls stuff like this, we didn't think it would be too serious. But let's take a look at how much force really hit him. We're going to assume that Zuniga has an average acceleration speed of about 7 meters per second squared. This is pretty fast for a professional soccer player. We're also going to assume that 50 out of his 72.2 kilograms of mass were directly involved in the collision between Zuniga's kneecap and Neymar's back. Remember, not all of Zuniga's mass was directed in one area of Neymar's back at the time.
With these assumptions in the formula force equals mass times acceleration, we're able to calculate that 350 newtons, which is half of Zuniga's weight, or around the weight of a dishwasher, were directed at a small specific segment of Neymar's back. Specifically, this part is called the vertebrae. Now we're going to be able to figure out the momentum that Zuniga was traveling at using the formula momentum equals mass times velocity. But to do that, we first have to figure out his velocity.
If he was 5 meters away and had an acceleration of about 7 meters per second squared, we can determine the velocity that he was traveling at by using the kinematic equation velocity squared is equal to initial velocity squared times plus 2 times the acceleration times the displacement. We will substitute 0 for the initial velocity, 7 for the acceleration, and 5 meters for the displacement. After doing all of the calculations, we found out that Zuniga was traveling at a velocity of about 8.37 meters per second when he hit Neymar.
Now that we found Zuniga's velocity, you can also use his previously acquired mass of 72.2 kilograms to learn that he had a momentum of 604.3 kilogram meters per second. Now that we were able to calculate these figures, we're able to learn more about what actually happened, the magnitude of the injury, and how it should be treated.
Before we begin, we don't want to bore you with all of this physics, so here's some more support as to why Neymar should win an Oscar in 2016. You know you're pretty infamous if a TV show makes fun of you for diving.
The squad features the greatest master of the fake injury soccer has ever known, El Divo.
And El Divo goes down.
Each vertebrae is short and small, and comprise what we know as the spine. In Neymar's case, Zuniga provided enough force in this region to break his vertebrae, giving Neymar extreme pain and preventing him from doing any other physical activity. So Doc, how does Neymar look in terms of the rest of the World Cup?
The news is not easy, Alright, Big Munchie. Unfortunately, Neymar will be out for the remainder of the World Cup, but there is some bright news in this issue. He will not have to undergo surgery, and instead will go through conservative treatment, including physiotherapy and comfort to ease the pain. He will be able to return to training with Barcelona by the beginning of next season.
And there you have it, folks. So folks, today I'm here with head Brazilian coach Luis Scolari. So coach, how does Neymar look in terms of the rest of the season?
Well, he's definitely going to be out for the rest of the World Cup. Our team doctor said he should return for the season with Barcelona, but it's tough. You know, we're losing a crucial player, and he's going to have to undergo a series of tests to see how serious it is. But really, I think that we can still carry on. We can still push on. It's a team of many members. Neymar is only one, and as crucial as he is, I think we can push through. We have quality and quantity in our team.
There you have it, folks. Straight from Super Mario. Dad, as a well-versed professional on the human body, what treatment options would a fracture like Neymar consist of?
Well, in general, The two most popular treatment options for back pain are vertebroplasty and kyphoplasty. These treatment options are more commonly used for patients who suffer from osteoporosis. Since Neymar's fracture is benign, treatment options should remain on a passive scale and he should be able to play very soon.
There you have it, folks. I guess this is good news for Barcelona fans everywhere. I am Jochen and this has been Insight from the Expert.
So we're able to look at Neymar's injury, its magnitude, math and science involved, its impact on Brazil in the World Cup, as well as opinions from both the coach and team doctor.
Well, there you have it, folks. I'm Scott Alberti.
And Antonio Livakovic.
And this has been Sports Science. The injury that Neymar suffered was a forceful blow to his vertebrae. If you did not know, are you kidding me? I'm keeping that. No country.
Folks, you're able to